The GM Care Record, why it's important and how to use it. As someone who works in health or social care, easy access to patient information is critical to support your decision-making, especially in situations such as the COVID-19 pandemic. That's where the Greater Manchester Care Record comes in. The GM Care Record pulls vital patient data from several areas, including primary care, community services, mental health services, social care, secondary care and the specialist services, and collates it into one place, making it easily accessible for those who need it to inform direct care. The amount of data that the GM Care Record holds is increasing. Data is constantly being added, so a combined record can be developed for all our citizens. From medications to test results, there's a wealth of patient data available. GP, social care and mental health data is updated overnight, and hospital data is updated almost immediately. If you can't find a piece of patient data in the GM Care Record, it might be elsewhere. Do not assume that the person you are treating has no medical history. So, how can you use it? First, you need to access the GM Care Record. This can be done on a desktop or tablet in one of two ways. 1. Via a link in your clinical system, which is how most staff will access the record. Or 2. Via the website if you are in the community. If you've logged in from the website, you'll see the search page. Click on a patient to see their landing page. Whichever route you use to access the GM Care Record, you'll need to complete a short reason to view form. It's easy and only takes a couple of seconds. After this has been completed, you'll see the patient record landing page. If the patient record has alerts available, important information will be shown. For example, all updates relating to COVID-19, where they exist, will be shown as pop-up alerts. At the top of the landing page are navigation icons. These are an easy, one-click way to get the data you need, without having to scroll through the entire record. Depending on your permissions, you may see different icons or see them in a different order. Let's take a closer look at the data available. The GP COVID-19 status icon is located at the very top of the landing page and shows clinically important information around COVID-19, which has been provided by primary care. If COVID-19 data is available and has been received from the GP overnight feed, an entries count will be visible. Clicking the icon will show the details from the primary care system, with a date, description, and any relevant comments provided. Clicking on the Problems icon will take you to the Problems page. This displays the patient's problems, whether active or past. With this information, you can gain a clearer understanding of the health status of the patient, which could help with the issuing of death certificates. You can also access the patient's medication using the Medications icon, where we might find issued or repeat medications. Whether you're based in a hospital or in the community, you can access any secondary care appointments and attendances using the activity icon. This includes inpatient, outpatient, ED, and GP encounters. If available, GPs can see the patient's last test results from GM Acute Trusts, or vice versa, by using the results icon. The GM Care Record pulls social care information from local authorities, and you can find it under the social care icon. This feed includes social work involvement, carer support, packages of care, and contact information. It can provide you with detailed information about the current support in the home. If a patient has an Electronic Palliative Care Coordination Service (EPACS) form that has been created in the GM Care Record, it will be visible on their landing page. Depending on your permissions, you can create, view, update, amend and publish EPACS forms and care plans to the GM Care Record. You may find that the EPACS is greyed out, which means that the patient hasn't had one created in the GM Care Record. This doesn't mean that an end-of-life plan doesn't exist, for example, at the patient's home on paper. Any end-of-life plan should always be reviewed and discussed with the patient and amended accordingly. The GM Care Record is an evolving system with new features coming, and more data is being added daily. It will continuously improve to meet the ever-changing needs and demands of healthcare in Greater Manchester. Remember, a patient's information may exist elsewhere outside of the GM Care record. Visit the GM Care record now. For help and support, contact your local ICT team or visit www.healthinnovationmanchester.com/GM Care record for more information.